The state is reporting more than 1,200 new cases of coronavirus tonight. We've been averaging almost 1,100 a day for the last week now, as the total nears 138,000. 30 more lives have also been lost to COVID-19, 10 of those identified from a review of vital records.
And joining us now to talk about the spike in COVID cases in our state is Robert Gordon, Director of the Michigan Department of Health and Human Services. Thank you for joining us this evening, Robert.
Thank you for having me.
Well, can you talk about what may be behind this spike in numbers? Is it that some students are back together again, more mingling as life gets back to normal, the weather changing? I mean, maybe all of those.
Yeah, I think it's all of those things. Cases are up, hospitalizations are up, sadly fatalities are up, and it's about people moving indoors, students back in school, colleges back in session. So all those things I think are contributing.
So what are the steps that you are asking us as Michiganders to take to prevent our hospital system from being overwhelmed with sickness?
Yeah, we got to keep doing the things that science tells us to do, which means wearing masks over our nose and mouth. It means social distancing, keeping 6 feet from people who aren't in our family, particularly when we're indoors, washing our hands. And if you haven't gotten your flu shot, it's time, and please do that.
And Robert, you've issued an emergency order to clarify what gatherings should look like. Can you describe that for us?
Yeah, so this is an order. It's under a law that was enacted after the Spanish flu. So it's a 100-year-old law for exactly this time. And it just says simple stuff: no gatherings in households of more than 10 people, outside up to 100, below capacity in restaurants, bars, businesses. People can still do things that make them happy. They just have to be safe and smart. And if we do that, if we wear masks, if we socially distance, those are the things that are going to help us bend the curve down.
And as we learn more about how this virus operates, because we're learning with each of the new infection rates that go up, 40% of those infected are asymptomatic, correct?
That's right. So there's so much risk. Just because you feel well doesn't mean that you're not spreading the virus, unfortunately. Just because you see someone who looks well, it doesn't mean that they couldn't give it to you. Those are the big risks. One thing I want to say is folks in Detroit have done a great job. As spring was such a terrible time, Detroit has bent the curve as much as anyone in the state and is really succeeding right now. So we just got to keep at it. That's the most important thing.
Yes, and Robert, thank you. Before we let you go, we learned New York's governor added Michigan to its travel advisory, so anyone visiting that state must quarantine for 14 days. Do you see that ever happening here in Michigan?
You know, it's something that we've talked about. It's, I think, something that we have to look at as we go forward. Unfortunately, while we are facing challenges right now, there are other states facing a lot more because we've been doing our work. So yeah, it's something that we will be looking at.
All right, Robert, we thank you for your time and information for joining us today.
Thanks for having me.